Aloha everyone, my name is Jonathan Pete Sayabong, and for my presentation, I will be advocating for reducing the prevalence of alcohol abuse amongst adults in Hawaii. So why I chose this topic was because I just find alcohol-related topics to be very interesting. We eventually get introduced to it in life and realize that we're always surrounded by it and we have easy access once we turn 21. I think that alcohol has been a part of culture in many different ways, and sometimes we like to include it into our activities to have some fun. But that is not always the case, as it can lead to something much more serious. Definitely, drinking excessively can affect our health and wellness, and consuming too much of this substance can lead to one thing to another. So, my vision for this project is to ensure that everyone knows their limits when it comes to drinking. Drinking does not resolve all issues, but it is good to know when enough is enough. My desired outcomes for this project is to ensure that I am highly knowledgeable in this issue, collecting good, credible data and resources to aid what I am advocating for, and to ultimately spread awareness on the effects and consequences of alcohol abuse in adults. So essentially advocating different interventions to maintain a healthy lifestyle while still being able to drink alcohol or even escaping the alcohol abuse lifestyle to start building back their health and wellness. So here we have the current situation in the United States. So by looking at these stats, we can tell that it's pretty bad, especially those who are, underage have a problem with excessive drinking, which is not good. Um, you know, Alcohol causes 13.5% of deaths among, 20 to 39-year-olds. And, it gets even worse as the pandemic started. Um, and it just continues to increase more and more throughout the years. Here is the current situation in Hawaii. The current situation in Hawaii isn't too bad compared to other states in the US, but Hawaii still has issues with adults who do drink excessively. So with um, the 35 to 44 age group, they have the highest percentage um, of adults who drink excessively at 26.8%. And the other two age groups are just below the highest one, which has really no significant difference. And male alcohol related deaths are the nation's highest here in Hawaii. So how did we get here? Alcoholism has come from, a long history of cultural, genetic, and environmental factors. Of course, as people start to become addicted to alcohol, it begins to create multiple health problems that could either be short-term, long-term, or even death. Excessive drinking has been increasing over the years and is still prevalent amongst adults, especially during the COVID-19 pandemic. So even as our society continues to grow, there are still ways for adults to reach the point of excessive alcohol use. It has been a growing public health issue as people find the substance to be addicting. So the main reasons why people continue to drink is either for pleasure and having a good time, or those who suffer from mental disorders, which can lead to excessive alcohol consumption as they feel that it would solve their problems, but it really isn't, and it's only making it worse for them. So the CDC recommended some strategies such as increasing alcohol excise taxes, regulate alcohol outlet density, or maintaining limits on the days and hours when alcohol can be sold. So as some of these strategies may be beneficial, it will be very challenging as it will be difficult to maintain because there will be people who are desperate and willing to spend a lot of money on alcohol. So who is affected? Mainly adults who tend to drink more than usual throughout the day or week. Now, I get that people love to drink, but it shouldn't be to the point where it starts to become an addiction or abuse. Consuming alcohol in general can increases the risk of getting into an accident, um, and it may lead to poor health physically and mentally. Um, and also adults could influence their loved ones through either peer pressure or setting the example, especially if they have children. When they see you drink very often, they might find it to be a norm, and they could potentially become um, addicted to it once they are introduced to alcohol. So my strategy in action that I came up with is to hold a monthly community event on alcohol abuse prevention. So this event would occur at the beginning of every month. This event would hold a variety of activities that are related to the effects of alcohol. Um, Such activities are like wearing, drunk goggles to, perform certain tasks and whatnot. Um, the event will provide free information regarding the effects of heavy alcohol use through presentations and Q&A sessions with experts on this topic. And, free resources and programs will be provided to those who need it. So also with this monthly event, adults can earn a chance to win a prize like a new iPhone 13 or a gift card or even a free trip. And that can be an incentive for those who or for our target population to help potentially lower their alcohol intake throughout the month. So for every event, there will be a prize to give away. Anyone 21 and older who wants a prize must, limit their alcohol intake to 10 drinks from the previous month, and that will earn them a chance to have their name in a bowl. And at the end of the event, one or two names will be picked out of the bowl, and they will earn the prize. Um, Overall, it will be an educational and promotional event for among all ages, but we value the integrity for those who don't drink underage, and we support those who drink responsibly. And we hope that this will help communities to think about their perspectives and choices on alcohol abuse and realize that too much will lead to something worse. So as my visual product, I have flyer, nothing too special. It's basic, straight to the point, and hopefully this will catch the eyes of my target population, and hopefully they'll be willing to attend the event. Here's my first side of my informational product. I created a brochure. Again, nothing too special, pretty just straight to the point, simple. Here's the other side. This side's just a little bit more informational, just so that I can give my target population an idea of what this, who we are and what this event will hold. So some of the advantages for the strategy, um, it is an educational and promotional event, for all ages. It's very engaging and motivational. Um, it challenges people. It challenges for those who drink excessively, and for those who love to drink. Um, as mentioned earlier, it's about knowing your limits and realizing when enough is enough. So um, and then it's also, the strategy is very consistent as this event is held every month. So, we can spread constant awareness to different communities so that everyone can get the same experiences. And, lastly, our goal is to minimize drinking. Some disadvantages that we have is that, as alcohol is part of culture and it's normalized amongst adults over 21 years of age, some people would care less about like knowing the effects of excessive drinking, as their main intent is to either have fun and get lit or to help solve their problems mentally. This event may also be tedious and expensive to hold every month. Um, so some of the things that we have from previous month, uh, we may not have for the next month. And also there'll be an integrity system that we all have to follow. People would only come just for the prize, or maybe people would somehow cheat the system or the prize, but it defeats the whole purpose of that part of the event. So, but we're trying to help decrease their intake of alcohol during the month. So, in order to mobilize to get more results, so we included like some organizations that will help our target population out, and they'll help us spread the awareness and overall promote health and wellness to those who do need it. And it's just a form of it's an educational event, and hopefully that will give us good results. So for measurement, to measure success is surveying. We have a survey already prepared. for them, and people have the option to take the survey. And this survey would essentially entail what their experience was like and what we can improve on for the future events. So overall, providing us feedback so that we can know what we need to work on, and we'll encourage people to take the survey, and hopefully their responses will be genuine. So is this project feasible? I think this project, you know, it works both ways. Like, overall, it really depends on, the person, because, we can't necessarily like, force people to come to the event or force people to, um, make their decisions. But, overall, hopefully, what they gain from this, event, the most essential component is, giving them like the free resources and programs that could really help them if they, have a serious issue with alcohol. So here are my references that I utilized. And this concludes my presentation. Thank you for listening.